The 8 early signs of heart failure you shouldn't ignore. What if you had a serious health condition, but had no idea? A study of community patients with heart failure found that a staggering 63% were completely unaware they had it. Even more concerning, misdiagnosis rates can be as high as 68%, with symptoms often being dismissed until they become an emergency. This isn't a rare disease. We're talking about heart failure, a condition that affects nearly 6.7 million adults in the United States alone, with that number projected to climb to over 8 million by 2030. Welcome to Dose and Diagnosis. Today, we're tackling a silent epidemic. And let's be clear, heart failure doesn't mean your heart suddenly stops. It's a progressive condition where the heart muscle gradually weakens, becoming less able to pump blood effectively. The real danger lies in its early signs, which are incredibly subtle and easy to ignore. This is where a critical error in our thinking puts us at risk. We are experts at explaining away the subtle whispers from our own bodies. We might feel a little off or notice a minor change in our daily stamina, and immediately our minds jump to the most convenient conclusion. I'm just getting older. I'm just out of shape. Or I've been working too hard. We attribute these signals to the wrong cause, and in doing so, we unknowingly close the critical window for early detection. But what if those seemingly minor issues are actually your body's first distress calls? What are the specific red flags that separate everyday tiredness from a critical warning sign? In this video, we are going to expose the 8 early signs of heart failure you shouldn't ignore. By the end of this video, you will have the knowledge to spot these subtle clues that too many people overlook. Stay with us. Please note, this video is for informational purposes only and not a substitute for medical advice. All information provided has been carefully verified. Source links are available in the description. 1. Exertional dyspnea. One of the most common and earliest indicators of a struggling heart is a feeling of breathlessness during activities that were once routine and easy. This is known medically as exertional dyspnea. It's not the normal, expected panting you experience after a strenuous workout. It's a disproportionate and uncomfortable shortness of breath from simple physical tasks like climbing a single flight of stairs, carrying a load of laundry, or even walking at a brisk pace across a parking lot. This sensation can make you feel as though you can't get enough air in, forcing you to stop and catch your breath frequently. This early symptom reflects a fundamental imbalance between your body's needs and your heart's ability to provide. This distressing symptom arises because your heart's pumping capacity, specifically its cardiac output, is compromised. When you exert yourself, your muscles and organs demand more oxygen-rich blood to fuel their increased activity. However, a weakened heart cannot meet this heightened demand. This inefficiency causes blood to back up in the circulatory system, leading to a significant rise in pressure within the blood vessels of your lungs. This condition, medically termed pulmonary venous hypertension, forces fluid to leak from the capillaries into the delicate tissues of the lungs. This accumulation of fluid, or interstitial edema, makes the lungs stiff and less efficient at gas exchange, which you experience as a profound feeling of breathlessness. Research from the Japanese Cardiovascular Health Study powerfully highlighted this connection in patients recovering from acute decompensated heart failure. In this study, scientists found a strong and statistically significant correlation between the intensity of exertional dyspnea, which was measured using a visual analog scale, and the length of time patients required for their mobilization and rehabilitation programs. This demonstrated that more significant breathlessness was a clear indicator of a more severe underlying cardiac issue, one that necessitated a longer and more intensive period of recovery, underscoring its importance as a key diagnostic and prognostic sign. 2. Persistent fatigue. Imagine feeling a bone-deep weariness that never seems to lift, no matter how much you rest or sleep. This profound and persistent fatigue is a hallmark early sign of heart failure, one that can significantly impair your ability to perform daily tasks and enjoy life's activities. It's a systemic exhaustion that isn't relieved by a good night's sleep or a relaxing weekend. This overwhelming sense of tiredness is often accompanied by a noticeable decrease in your physical stamina, a condition known as exercise intolerance, where activities that were once manageable now feel like monumental efforts. This isn't just feeling tired. It's a fundamental lack of energy at a cellular level. This pervasive fatigue occurs because of a primary defect in heart failure, reduced cardiac output. In simple terms, the heart isn't pumping enough oxygenated blood to meet the body's ongoing metabolic demands. Your muscles and tissues are essentially being starved of the fuel they need to function optimally. The body cleverly tries to compensate for this deficit by diverting the limited blood flow away from less vital areas, such as the limbs and skeletal muscles, and redirecting it towards critical organs like the brain and the heart itself. This diversion leaves your muscles chronically underperfused, leading to that debilitating feeling of being perpetually drained and weak, even with minimal exertion. Scientific studies have extensively quantified the debilitating impact of this symptom and its direct link to cardiac function. The Profile of Mood States Fatigue Subscale study, which involved 150 heart failure patients with significantly reduced heart function, found that over half of both men and women reported high levels of fatigue. Multivariate analysis revealed that this fatigue was strongly linked to physical health, emotional well-being, and maximal workload. Critically, these patients achieved less than 50% of the maximal cardiac output compared to healthy individuals, and their peak oxygen uptake during exercise was drastically lower. 3. Pedal edema. Have you recently noticed that your shoes feel uncomfortably tight by the end of the day? Or have you seen deep indentations on your ankles after taking off your socks? This swelling in the feet and ankles, known medically as pedal edema, is a classic and highly visible early sign of heart failure. It occurs when your body begins to retain excess fluid, and the force of gravity naturally pulls this fluid down into the lowest parts of your body, your lower extremities. The swelling is often described as pitting, meaning that if you press a finger into the swollen area for a few seconds, it leaves a noticeable dimple that slowly fills back in. This noticeable fluid retention is a direct consequence of the heart's declining ability to pump blood efficiently throughout the body. When cardiac output decreases, the kidneys are one of the first organs to sense the reduced blood flow. Interpreting this as a sign of dehydration or low blood volume, the kidneys trigger a complex and powerful hormonal cascade, primarily through the renin-angiotensin-aldosterone system. This neurohormonal activation is a primitive survival mechanism designed to increase blood volume by signaling the body to hold onto sodium and, consequently, water. However, in the context of a weakened heart, this response backfires. The heart is unable to effectively circulate this increased fluid volume, leading to a state of systemic volume overload that manifests as visible swelling in the feet, ankles, and sometimes the legs and abdomen. The multi-ethnic study of atherosclerosis, MESA, a major long-term study, followed over 4,000 participants without known cardiovascular disease for more than a decade. The results were striking. The study revealed that individuals who presented with pedal edema had a statistically significant 44% increased risk of being hospitalized for heart failure during the follow-up period. This swelling often serves as one of the first externally visible signs of a significant fluid imbalance within the body, frequently appearing even before more alarming symptoms like pulmonary congestion and breathlessness become apparent, making it a crucial physical clue to watch for. 4. Orthopnea. If you find yourself needing to strategically prop your head and upper body up with 2, 3, or even more pillows just to breathe comfortably enough to fall asleep, you may be experiencing a specific medical symptom called orthopnea. This is a distinct type of breathlessness that occurs specifically when you lie flat and is promptly relieved by sitting up or standing. The sensation can range from a mild discomfort to a frightening feeling of suffocation, often causing anxiety around bedtime and forcing you to adopt a semi-upright sleeping position. This symptom is a direct mechanical consequence of how fluid behaves in the body when the heart is failing. The mechanism behind orthopnea is rooted in simple physics combined with a compromised cardiovascular system. When you lie down after being upright for most of the day, the fluid that may have accumulated in your lower body and abdomen is no longer held down by gravity. This fluid is redistributed throughout your circulatory system, significantly increasing the volume of blood returning to the right side of your heart, a process called increased venous return. A healthy, strong heart can easily handle this temporary increase in volume, pumping it efficiently through the lungs and out to the body. However, a failing heart, particularly a weak left ventricle, cannot keep pace. This leads to a rapid and dangerous backup of blood and pressure in the pulmonary capillaries, causing fluid to congest the lungs and interfere with breathing. While not every individual who experiences orthopnea has heart failure, it is considered a highly specific indicator of the condition, meaning its presence strongly suggests a cardiac issue. The landmark Cardiovascular Health Study, which analyzed health data from nearly 6,000 participants, found that orthopnea had an impressive specificity of over 94% for diagnosing prevalent heart failure. This means that while many people with heart failure might not report this particular symptom, it has low sensitivity. Its presence is a very powerful clue that the heart is struggling with fluid management. For this reason, the development of orthopnea is an essential symptom to discuss with your doctor, as it points directly toward underlying cardiac dysfunction. 5. Paroxysmal nocturnal dyspnea. A more dramatic, frightening, and specific symptom of heart failure is paroxysmal nocturnal dyspnea, commonly abbreviated as PND. This is not a gentle onset of breathlessness. It is a sudden and severe episode of shortness of breath and coughing that abruptly awakens you from a deep sleep, typically 1 to 2 hours after you've drifted off. You might wake up in a state of panic, gasping for air, feeling a sense of impending doom, and instinctively rushing to sit up at the edge of the bed or stumble towards an open window in a desperate attempt to find relief. These episodes are profoundly distressing and are a clear sign of significant fluid congestion in the lungs. PND is essentially a more acute and severe manifestation of the same physiological process that causes orthopnea. As you sleep in a recumbent, lying down, position, fluid that has been slowly reabsorbed from your lower extremities gradually accumulates in your lung tissues. The compromised left ventricle of the heart is unable to effectively pump the increased blood volume forward into the body's circulation. As the night progresses, this causes a critical backup of pressure that results in acute pulmonary edema, a condition where fluid floods the alveoli, the tiny air sacs in the lungs where oxygen exchange occurs. Research from the extensive Cardiovascular Health Study underscores the profound diagnostic importance of this terrifying symptom. The study found that PND demonstrated a high specificity of nearly 90% for a diagnosis of heart failure. More powerfully, the researchers concluded that the absence of both orthopnea and PND could predict the absence of heart failure with an almost 99% certainty in the older adult population studied. This makes these specific forms of nighttime breathing difficulties powerful negative predictors. 6. Rapid weight gain. Stepping on the scale and noticing a sudden, unexplained, and significant jump in your weight can be an alarming experience, and it's a critical early warning sign of worsening fluid retention in heart failure. This is not a weight gain that can be attributed to diet or lack of exercise. It's a rapid accumulation of excess fluid within your body's tissues. A gain of 2 to 3 pounds in a single 24-hour period, or a gain of 5 or more pounds in a week, is a significant red flag that should not be ignored. This rapid change reflects a serious shift in your body's fluid balance, driven directly by the failing heart. This rapid weight gain is propelled by the same underlying mechanisms that cause pedal edema, but it represents a more systemic and advanced state of fluid overload. A failing heart's reduced blood flow to the kidneys triggers a powerful hormonal response, primarily through the activation of the renin-angiotensin-aldosterone system, RAS. This complex hormonal cascade misinterprets the low blood flow as dehydration and signals your body to aggressively retain salt and water in an attempt to increase blood volume and improve circulation. A meticulously designed nested case control study that utilized daily weight monitoring for heart failure patients found that a weight gain of more than 2 to 5 pounds within a single week was associated with a nearly threefold increased odds of requiring hospitalization for acute decompensation. Even more dramatically, a weight gain of over 10 pounds increased that risk by a staggering 7.65 times. This creates a clear and predictable escalation of risk, making daily weight monitoring one of the most simple yet invaluable self-management tools for catching dangerous fluid retention early and allowing for timely medical intervention before a full-blown crisis develops. 7. Chronic cough. A persistent, hacking cough that doesn't seem to resolve, especially one that worsens significantly at night or whenever you lie down, could be what is known as a cardiac cough. While most people understandably associate a chronic cough with respiratory illnesses like a cold, allergies, or bronchitis, it can also be a subtle and often overlooked sign of fluid buildup in the lungs, pulmonary congestion, due to heart failure. This type of cough is often unproductive or may produce a small amount of white or pink-tinged frothy sputum, the pinkish hue indicating the presence of red blood cells that have been forced into the airways. The cough is frequently accompanied by a wheezing sound, similar to asthma, as the airways become narrowed by fluid. This distinctive cough is a direct physiological result of pulmonary congestion. When the left side of the heart fails to pump blood effectively out to the body, pressure builds up in the pulmonary veins, the vessels that carry blood from the lungs to the heart. This elevated pressure causes fluid to leak from the tiny capillaries into the lungs' interstitial spaces, the tissue surrounding the air sacs, and eventually into the air sacs themselves. This condition, known as interstitial edema, irritates the sensitive nerve receptors located in the bronchial tubes, triggering a chronic cough reflex as the body instinctively attempts to clear the airways of this fluid. While large-scale, controlled trials focusing specifically on cardiac cough as a primary early indicator of heart failure are still somewhat limited, its clinical significance is well recognized and documented in medical literature and case series. For instance, a 2025 case report described a patient whose only presenting symptom for months was a chronic, unexplained cough, which, after extensive respiratory workups proved fruitless, ultimately led to a cardiac evaluation and a diagnosis of heart failure. 8. Sleep disturbances and insomnia. Consistently struggling to fall asleep, stay asleep, or experiencing non-restorative sleep can be more than just a consequence of modern life stresses. It can be a significant, multifaceted sign of underlying heart failure. Sleep disruption in this context is not a single issue, but rather arises from a potent combination of the condition's physical symptoms and its profound biochemical effects on the body. The physical discomfort and anxiety caused by orthopnea, the inability to breathe comfortably while lying flat, or being abruptly and violently awakened by episodes of paroxysmal nocturnal dyspnea, directly fragment sleep patterns and can lead to a conditioned fear of going to bed. Beyond these direct physical interruptions, there are also powerful biochemical reasons for poor sleep in heart failure patients. The condition is associated with a chronic state of overactivation of the sympathetic nervous system, the body's fight or flight response, as it tries to compensate for the failing heart. This leads to elevated levels of circulating catecholamines, such as adrenaline, which can interfere with the natural architecture of sleep, preventing the brain from entering the deep, restorative stages of rest. This state of constant neurohormonal activation can manifest as insomnia, frequent awakenings, and a feeling of being unrest even after spending many hours in bed. A detailed analysis of data from the National Health and Nutrition Examination Survey, NHANES, revealed that the presence of insomnia was associated with a staggering 5-fold increased odds of having heart failure, even after adjusting for other confounding factors. Moreover, a sophisticated genetic analysis technique known as Mendelian randomization has confirmed a causal relationship, showing that a genetic predisposition to sleeplessness can actually increase an individual's risk of developing heart failure over time. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.